As always, I'm going to welcome you and start with the bottom line to this video. The test I'm about to perform shows that I am deficient in vitamin D. Interesting that my results are 22 nanograms per mil, which is 55 nanomoles per litre, lower than we would want. If you want to watch the video, you'll learn much more about it. You're very welcome to this video. Now, what I'm going to do today is I'm going to try and evaluate what my own blood vitamin D levels are. Because I've been taking about 3,000, 2 to 3,000. I started off the winter with about 2,000 units of vitamin D a day. I've gone up to about 3,000 lately. Is that putting my blood levels up enough? Because that's the key thing, how much vitamin D is in the blood. And if you've been following this video series, I think you might be fairly convinced that vitamin D is important for immunity and for immunomodulation to prevent excessive inflammation. And on this video we'll be giving you lots of additional evidence about the importance of vitamin D as well. Anyway, on to the first test. This one's your personalised vitamins test. So it's that box there, it comes in a box, and we're going to do the test now. Now, I'm not very good with mobile phones. In fact, I've had to borrow one for this occasion. It's talks you through the test. So let's see where we're up. Yep, so I've already started. It says you'll need 20 minutes to do the test. So let's continue. So let's go start test. Click.
Rub the finger until it is warm with good blood circulation.
Telling me what to do. So my finger is warm, okay? Completed. I have to clean my finger now. It really is an idiot guide, this one. I mean, so there we have a clean finger with an alcohol swab, and we just wave that around in the air to let it dry. Complete. What's next? Oh, get the pricker. I thought there might be a pricker involved, so there's the pricker thing. Right, so I've unscrewed that and removed the safety device. Now I prick my finger. Let's do that for the second time today. Good, so that's me pricked. Right. Complete. Oh, I have to suck the blood up now with this device here. Now that bit goes into there. And we give that a bit of a shake up. Now we take out the test kit bed. And there we have it. Okay, so that bit's completed. Now I remove that, still bleeding, remove that cap. No, not that one. Remove that one, that's it. And then I put some drops on there, 4 drops I think it says. 1, 2, 3, 4 drops. And we start the timer. And we wait for 15 minutes. Still waiting. So, nearly done. 10 seconds. Then we'll have to scan it to get the results after this. We've got a 2-minute window in which to scan it, so we'd better get this right. Okay, scan test. How do we do this? There we go. There we go. So we've scanned it. And my result is 22 nanograms per mil. Now I am pretty surprised. That is actually quite a bit lower than I would have thought, because I've been taking 2 to 3,000 units of vitamin D a day. Now, one of the things, so let me just write that down, 22 nanograms a mil. There we go, 22 nanograms a mil. Now, I'm a little surprised it's as low as that. That is really quite interesting. And this is all genuine. I'm doing this completely live time. Now, as I say, I have no financial interest in this group at all. But one of the things I do like is you can go onto their website and you pay a subscription for a year. And I'll put the prices in and the links in the description. But then what they do is they'll prescribe or suggest the right amount to titrate your vitamin D up. So that's 1,000 units a day you might need. That's 4,000 units a day you might need. Or some people might need a top-up dose, 20,000 units per day. So there you go. I'm actually quite surprised mine's as low because, as I say, all last summer, I spent quite a lot of time working in my allotment with sun exposure. Since September, I've been taking 2,000 units a day, and in the past few weeks, I've bumped it up to 3,000 units a day, and it's still only 22 nanograms per mil. So that is interesting and surprising. Now, there is another test coming. We are going to sort of collaborate the result of this. But on the basis of that, I'm going to increase my vitamin D intake. Interesting. So there you go. Yeah, surprisingly low. Now we're going to try this vitamin D test here, blood spot test for vitamin D public service. And this is an NHS facility. And it gives you all the instructions you need to follow there. Hope I don't mess it up. Pricking your finger, putting the blood on. And it gives you some more detailed instructions in this booklet. So without further ado, let's go for it. So the first thing, let's go on to the overhead. First thing is I need to clean my finger. So they give you an alcohol swab for that. So we'll give that a bit of a clean. There we go. Let that dry. Now they give you these pricker things here. So now I haven't used this particular type before, so let's hope this works. So we'll give my finger a good old prick. There we go. And the first blood you should wipe away like that. Then we give a bit of a squeeze. Hopefully you can see the blood coming there. And we put that on the first spot. We don't touch, we just drop it on like that. There we go. And we squeeze some more. It's amazing how much blood you can milk out of one of these little pricks if you give it a bit of a squeeze. There we go. And one more. Oh, the blood's going all over the place now. That's a bit of a pathetic one, but there you go. And then we can just wipe your finger. Apologies to the lab people for messing up their card. They will be wearing gloves, obviously, when they do that. Oh, it's still bleeding, look, so no other blood test required, though, so just put that on. And then all you do is just close that up. There should be a sticky strip there, yep. Take that off. Fold that over and stick it down. And there we have it. We don't know what it is straight away, so it goes in the bag and we send it off with the consent form. And please don't worry, I did remember to put my date of birth on before I sent that off. It just slipped my mind before. So when those results come out, you're going to be the first to know. Now, having looked at those tests that measure the amount of vitamin D in the blood, I want to go on and clarify a few things about vitamin D that people get confused about, because we've looked at so many videos on this channel. We've done so many videos of how important vitamin D is for immunity and for preventing excess inflammation. It is an immunomodulator. So it's very important to know about now, and indeed as we'll see at any time. But let's just clarify some of the things that cause confusion. Now, one of the things I'm always being asked about is, should we take vitamin D3 or should we take vitamin D2? Now, vitamin D, getting vitamin D into the body. Now, vitamin D3 is the form of vitamin D that's produced by animals. And vitamin D2 is the form of vitamin D that is produced by plants. Now, whether you take vitamin D2 or vitamin D3 doesn't matter too much. The body can convert both of those types into the active form. There is some evidence that vitamin D3 might be converted more efficiently and result in slightly higher levels, but both are completely acceptable. Now, because humans are animals, of course, the vitamin D we produce in our skin is the vitamin D3 form. So vitamin D3, that's called cholecalciferol, is the name of that vitamin. We get that from the sun, or it comes from animal sources, or it comes from supplements. That's how we get it into the diet. Now, D2 is called ergocalciferol, and that comes from plants, and it can come from supplements as well. Now, if you're a vegetarian watching this, then feel free to take vitamin D3 tablets, because the vitamin D3 we get in the tablets doesn't come from animals, it is synthesized. So vegetarians can eat either form. And the vitamin D2 actually is only in, the only plants I know that there's any significant amount of vitamin D2 in are marine phytoplankton, the small plants in the sea, and mushrooms. And even then, it's only if the mushrooms are exposed to ultraviolet B radiation that the mushrooms produce vitamin D2. And isn't it weird that the same ultraviolet B radiation will result in the production of vitamin D in me and vitamin D in plants, albeit a slightly different, or fungi rather. Mushrooms are fungi, they're not really plants, are they? So interesting, but that's the difference between the two. So both are absolutely fine, and both will increase your vitamin D levels in the blood. But we tend to take vitamin D3 out of default. Where have I gone? There I am. Now, what is the pathway? Well, in the skin, the vitamin D is produced. And because we're animals, we produce the cholecalciferol form of vitamin D. That's synthesized in the lower part of the epidermis, which is the upper layer of the skin. So it's produced in the upper part of the lower layer of the skin. But the vitamin D that we produce in the skin, the cholecalciferol, isn't any good to us until it's been metabolically activated. Now, the main biochemical factory of the body is the liver, and the liver is located here and there underneath the right costal margin in there. So it goes from the skin to the liver. So this cholecalciferol goes in the blood and it goes to the liver, and in the liver it undergoes biochemical processing, because that's what the liver does. The individual liver cells, the hepatocytes, have all sorts of enzymic systems inside them, and that the liver converts it into its major circulating form. That's 25 hydroxy vitamin D, written like that, and it's called calcifediol. So the cholecalciferol produced in the skin is converted into calcifediol in the liver. And this is the form that we measure in the blood. This is the most abundant form, but it's not actually the most physiologically active form. That has this calcifediol then goes to the kidneys, and that's converted into 125 hydroxy vitamin D3, or the name for that is calcitriol. So calcitriol is the active vitamin D hormone. And you probably remember that a hormone is a chemical substance produced in one part of the body that circulates into the blood and has a physiological action in another part of the body. So this calcitriol is produced in the kidneys, therefore it's classified as an endocrine hormone, and it has effects all around the body in multiple cell types, not least of which is the immune cells. So it is a hormone communicating with the immune cells. So I hope that kind of clears that up a bit. So it starts in the skin, activated in the liver, and then further metabolized in the kidneys to give the end product. So we go from cholecalciferol to calcifediol to calcitriol. That is the way that aspect of physiology works. So the vitamin D, just to mention there, people who have kidney disease, they have really big problems with this, because even though their liver can make the calcifediol, their kidneys can't convert it into calcitriol, and they have big problems because they can't produce it if people have renal failure. Big problem in patients with chronic kidney disease, as we call it now, CKD. Vitamin D in the blood then is 25 hydroxy vitamin D. Sometimes the words are separate, sometimes they're written together. It's exactly the same stuff. Or calcifediol, exactly the same substance. So all of these are the same thing. This is where it gets a bit confusing. People calling it different things. So there you go. Calcifediol is probably the one to remember. And the circulating concentrations of the calcifediol is the accepted biomarker for vitamin D status. So this is the one we measure to see what our vitamin D levels are, as we've done in those tests. But, of course, we have to now argue about what the level should be. Now, the problem with vitamin D is, of course, that it was discovered, 100 years ago, that lack of vitamin D, 100 years, more than 100 years ago, probably about 110, 120 years ago, that vitamin D and calcium are essential for bone health and muscle health. So the levels tended to be taken, the blood levels that were accepted as being acceptable, as good, were those that were high enough to prevent rickets, the bendy bone disease that's caused by lack of calcium and vitamin D. But now we know vitamin D does so many other things, it may well be that a higher level is actually optimum. Because what we want to know, we don't want to know what the minimum levels are for health, we want to know what the optimum levels are. I want to promote my health as much as I possibly can, not just eliminate deficiency diseases. So it's a bit difficult to say, but what we're going to do, this is the National Institutes of Health, US National Library of Medicine, look it up on Medline Plus, there's the link. Direct quotes because I put it in italics. Many experts recommend a level between 20 and 40 nanograms per mil. That's 50 to 100 nanomoles per litre. And I'm going to just spell out a little bit about what that means in a minute. Others recommend a level between 30 to 50 nanograms per mil. That's 75 to 125 nanomoles per litre. And I would certainly think that this is getting closer to the levels that we want to have, as we've found out so many other things that this activated form of vitamin D, this calcitriol hormone, is responsible for. Some say high levels. I'm not going to debate it, but feel free to follow up some links if you would like to. Well, here we are. Based on the National Institutes of Health, many experts recommend a level between 20 and 40 nanograms per mil. Mine is 22 nanograms per mil, and that equals 55 nanomoles per litre. So I am in the lower range of normal, despite taking quite what I consider to be fairly reasonable doses of vitamin D, and I'm certainly well below what other experts recommend and well below what other experts yet recommend. So I must say I expected my levels to be higher than that because I've been taking quite a lot of supplement. So if I've been taking 2,000 to 3,000 units of vitamin D a day over the last few months, and my vitamin D levels are only just into the acceptable range, in the lower end of the acceptable range, then if everyone was like me, how much good do you think the 400 international units that the government is recommending is going to be doing? If I've been taking 4, 5, 6 times that amount and I'm still at the bottom end of the normal range. Food for thought indeed. Food for thought indeed. Now let's just clarify those serum concentrations. Well, first of all, what is serum? Well, we know that blood is in two parts. Blood is partly plasma, and it's partly red cells. So we have plasma and we have red cells. But then when we give it to the haematologists in the lab, what they do is they'll put the blood in a centrifuge and they'll spin it down. So you end up with a lighter plasma on top and the cells on the bottom. Well, the part they're left with on top, that's called the serum. They call that the serum. And it's the serum where we take all our biochemical parameters from. So what's your urea, what's your electrolytes, what's your sodium, what's your potassium, what's your vitamin D levels are taken from the serum. So serum concentration units. Now, there's two lots of units. Now, nanograms per milliliter is what tends to be used in the States. Nanomoles per litre is a measure of concentration as well, and this is the one that's used in the UK predominantly and in Europe, although it does get a bit mixed up. So this measures the weight of vitamin D in nanograms per milliliter of blood, nanograms per mil. And if you're interested, there's 1,000 nanograms in a milligram, and there's 1,000 So there's 1,000 nanograms in, sorry, there's 1,000 nanograms in a microgram, and there's 1,000 micrograms in a milligram, and there's 1,000 milligrams in a gram. That's the way it goes. But this is another way of measuring it, nanomoles per litre, and the conversion here is times 2.5. So 1 nanogram per mil is equal to 2.5 nanomoles per litre. So you multiply it by 2.5 or divide it by 0, multiply it by 2.5 or by 0.4, depending on which way you want to go. So that's a bit confusing as well, but that's the answer to that. It's just two different ways of measuring it. This is actually more the SI unit. This is the more scientifically correct unit actually to measure it in terms of molar concentration. This one's a bit old-fashioned, to be quite honest, but it is predominantly used in the States. But it's used other places as well. So that takes us on to the practical question of supplements. And again, this is confusing as well because the supplements are measured in two ways. International units, which is kind of the more old-fashioned way of doing it really, and micrograms. And microgram being 1,000th of a milligram, of course. So supplements can be measured in micrograms or measured in international units, so it gets confusing again. Now, the government's currently recommending 400 international units in the UK a day as a supplement. That equals 10 micrograms. Many would say a pathetically, ridiculously small amount in an English, Scottish, Irish or Welsh, Northern Irish or Welsh situation. So 400 units is 10 micrograms, therefore 1,000 units is 25 micrograms, 2,000 international units is 50 micrograms, and 4,000 international units is 100 micrograms. So sometimes these, for example, what are these sold as? So they're vitamin Ds that I've been taking. They're 25. It says they're 25 micrograms. So it actually says 25 micrograms on it. That's kind of the more modern way to do it. And I don't think it actually says the amount in units there. And the ones we looked at before, 4,000 international. See this one's got it in international units, so that's 4,000 international units. Now, does it say 100 micrograms on there? Probably in the small print somewhere. Yeah, it says it. I think it says it up there. Only my eyes aren't quite good enough to see it. So just slightly confusing, but I mean it's exactly the same stuff. It's just different ways of measuring the amount. So how much should we be taking? Well, of course, the whole reason that we did these blood tests was so you can titrate the amount that you're taking. So what you should do is go to your doctor, ask him to measure your blood levels and let him prescribe the appropriate amount. But if that facility is not available, then the government issue guidelines how much to take in winter. And this is from the NHS site here directly. Now, they do recommend a relatively low amount, 400 international units, which is 10 micrograms. But then they say this: do not take more than 100 micrograms, that's 4,000 international units of vitamin D a day in people older than 11. So this is getting on towards a more sensible dose that would be required in a winter when you are not making any vitamin D yourself. And of course, people that are obese will need more. Actually, it's not so much that people that are obese and have a lot of adipose tissue need more. What happens is when you take the vitamin D goes into the fat first of all. But then when the fat is filled up with it, then it will go over into the blood. So if you are vitamin D deficient and you carry a bit more weight than you would like, then that's going to take a long time to fill up your fatty tissues before it spills over and increases your blood levels. And it's the blood levels that are the physiologically active part. But if you are obese and you're already topped up with vitamin D, then you just need the same amount as a thin person because you're already topped up, because the excess will not have to be stored in the fat because that's already full of vitamin D. It will go directly into the blood. Of course, if you've got darker coloured skin, you're going to make even less vitamin D in any sunshine we are exposed to. But basically, where I live in the north of England, I'm not going to make any vitamin D outside, or tiny amounts, between September and April, the sun needs to be quite high in the sky to make vitamin D, because the ultraviolet B, the UVB, is just filtered out by so much atmosphere as the sun goes at a narrower angle. Basically, the sun wants to be 45 degrees or higher in the sky to make significant amounts of vitamin D. So that's why that's important. So that's what the government is saying. So, of course, on this channel we can't prescribe. I can't prescribe for you. I don't know you, and you need to go to your own doctor who's got your notes and everything. But that's what the government is saying. 4,000 units a day is the maximum amount you should be taking. Children aged 1 to 10 years should have not more than 50 micrograms a day, which is 2,000 international units. And infants under 12 months should not have more than 25 micrograms, that's 1,000 units a day. So I am perfectly safe in saying that because they are direct from the NHS website and reflect government guidelines. So there you go. Personally, I've been taking, I've increased my intake now. I'm on about 3,000 international units a day, which is 75 micrograms. But there again, I've actually been taking it for some time. And last summer, I did quite a lot of work outside at my allotment, and it's not pleasant, but I tend to take my shirt off and do it in my shorts. So I was probably fairly topped up by about September because I had quite a lot of sun exposure last summer. So I've been taking 2,000 international units. Then I bumped it up to about 3,000 international units a day. So that's why it's useful to test, of course. Anyway, so there we are. They're the government guidelines on maximum units, and I certainly think that the 400 international units that's being given out to people that are guarding at the moment is a very low dose unless they're already topped up. And because we know there's a lot of vitamin D deficiency, it's likely that most of them are not topped up with vitamin D in their fatty tissues. So we've looked at so many videos on this channel showing how important vitamin D is for immunity. We know that lack of vitamin D inhibits the innate and the specific acquired immune system. And we know that lack of vitamin D is associated with this exaggerated inflammatory response. But what other research is there? Because vitamin D receptors are all over the body and so many people are short of it. And my ancestors used to be much darker coloured skin than me. And probably 6,000-7,000 years ago, my ancestors gradually went from being dark coloured skin to light coloured skin, so I could live up in the northern climates. My ancestors have been in Scotland for thousands of years, as far as I know. And the reason they're able to survive there is because they had lighter coloured skin, so the pathetic amount of sunshine you get in Scotland, although you can get some sunny weather in Scotland, but not that much. That they could make the most of the vitamin D that they get. That's the adaptive advantage of being white. So this is why it's involved in so many things. Vitamin D receptors in so many parts of the body. So let's have a look at some developing research now. Prostate cancer is the most common cancer in men, and this research is indicating that lack of vitamin D could be a factor in prostate cancer. Colon cancer, again, there's definite correlations between low vitamin D levels and colon cancer. Breast cancer also. Multiple sclerosis, that debilitating or potentially debilitating disease. We've always known that it's rare at the equator, so some links with multiple sclerosis. Heart disease, of different types of heart disease. Low levels of vitamin D, again, implemented there. Check it out. Immunity, we've talked about many times. Autoimmunity is where the body's own immune system beats up on its own tissues. So in type 1 diabetes, for example, the immune system eradicates the beta cells from the pancreatic islets of Langerhans, meaning you can't produce any insulin, meaning someone has type 1 diabetes. Now, I don't know about specific research related to vitamin D deficiency and type 1 diabetes, but certainly that it's not because it's not there, so I simply don't know. But I haven't checked that one out. But autoimmunity certainly is a factor. Type 2 diabetes is a factor. I mean, basically we have a pandemic of diabetes at the moment. 9% of the world's population at the moment are diabetic. A horrendous amount of people are diabetic. When I was working in Cambodia, about 20% of people in Cambodia are diabetic. It's horrendous. And they have awful complications from it. It's a pandemic of diabetes. We really need to get on top of this. Chronic pain and sleep, there's a reference there that vitamin D improves sleep. Depression is probably a factor, there's some evidence there. Cytokine storm and COVID, of course, we have done to death on this channel many times. And I am convinced by the correlations which have been demonstrated. So there we go, hope that helps about vitamin D. If you can get your vitamin D level checked by your doctor, do so, then you can titrate your levels up. But I think we've looked at quite a lot of evidence for why low levels of vitamin D are not a desirable situation. And I think it is reasonable to say there is a pandemic of vitamin D deficiency, which is unfortunately coinciding with the pandemic of COVID-19. So, thank you for that. Thank you for staying till the end if you have stayed. And that's us for this video.